Hello, everyone. Welcome to the 49th episode of Let's Talk Inclusion. My name is Manobina Chakraborty, the host for this talk show. And today we will discuss about autism intervention at home. In the panel of experts today, I have Ms. Anupam Verma and Dr. Sreyoshi Ghosh. Sadly, Mrs. Kavita Sharma couldn't join us because of some family health emergency. We will miss you, Kavita ji. And hello, Sreyoshi and Anupam. Welcome to Let's Talk Inclusion.
Hi, thanks
And
so much.
Hi everyone. Thank you, Manobina.
I will come to you, Dr. Sreyoshi Ghosh now. Sreyoshi is a child and adolescent psychiatrist. Sreyoshi, would you like to tell us more about your work?
Hi, thank you so much, Monavina, for having me over here today. I'm very excited to be a part of this panel. So, I'm a child and adolescent psychiatrist, and so I had done my residency in psychiatry, and then followed by that, I did a DM in child and adolescent psychiatry. Currently, I see children and adolescents, both neurotypical and those who are neurodivergent, which means individuals who may have autism or ADHD. So I see all such children with their families who may come with a variety of different problems, whether it's emotional problems like anxiety and depression, or behavioral issues like conduct problems and oppositionality. So the entire age range between 0 to 18. So essentially, clarifying diagnosis, and then seeing what sort of comorbidities there are, what all other problems are that this family is dealing with, and then figuring out, what is the best individualized plan to help this particular child. So, I mean, do they need, medication if the problem is quite severe, or is there sort of some environmental inputs that they may benefit from, related to the school or to the family, or is it that there's some behaviors that need modification with behavior therapy? So it's that's kind of a gist of what I do.
For your time. Thank you very much for coming here today, Sreyoshi.
My pleasure.
There's an echo, I think, from your end. Is it from your end, Sreyoshi? Yeah. Now it's fine. Now, Anupam, I will come to you now. You are on a very important mission as you started with your Heka Moms and Company. Could you please tell us about yourself a little more, Anupam?
Sure, Manobina. Manobina, as you know, and I would also like to tell all the listeners here that I am a proud mom of a 7-year-old child who is diagnosed with spectrum. She has ADHD, she has hypotonia, she has tosses, and she's a very strong child. She has her own struggles every day. And when she was born, I was being told that, there are series of hiccups that I would go through in terms of raising this particular child. And I've taken that heads on. Uh, as and when I was looking for therapies for my child, I realized that I was losing on to very precious time in terms of meeting her, meet the right therapist or the right people. And because of that, it was just reference that I was receiving. So I would go to one person for one particular therapy. From there, I would receive a reference, and I would eventually go to that second person for a particular set of therapy. Everything was not available to me under the same roof. Rather, it was becoming difficult for me to channelize my energy, also because there was a lot of precious time that I was losing in terms of, first, finalizing whom to reach to. Second, because as parent, you are very cautious in terms of who you want to handle your precious child to, even when you talk about therapists and all. So there would be centers where I was not very confident enough whether my child is receiving the best of the healthcare possible. And eventually I realized that I am, because of this particular gap, my child is facing a lot of issues which could have been met. Because she's on spectrum, when we have the right intervention at the right time happening, the child grows in terms of intellectual parameters. So this was not happening. Now, because of keeping everything in mind, I decided, why not have something with us that can offer parents of the special need children a platform on which they can access information without having to run through left and right, this and that. So my that's how we came up with the organization called as Little Heka Moms and Company. A brief about Little Heka. Heka is a Egyptian word which means god of medicine and magic. So I clearly go by the theory that where medicine doesn't work, magic of love, compassion, commitment works. So that's how we started with Little Heka Moms and Company. And today, as of now, I have series of people available to me on my panel, be it physiotherapists who are state awardees, be it behavioral therapist, be it play therapist. I even have music therapists with me who specialize in helping special need children. So that way, we have few children who are associated with us as of now, and we have been doing really well with them. So that's
So
about
nice.
me.
So nice. I wish you all the best,
Thank you
Anupam.
so much, Phenomena. Thank you so much. We definitely need all your support.
I will. I will be there with you all this. Now, Sreyoshi, since you are a doctor, could you please tell our viewers what what is the difference between treatment and intervention? Since our topic is related to autism intervention, so could you please tell us the difference?
So how I've really understood this is, when you're intending to treat something, you're saying that there is this particular disease that needs treatment, or there is a particular disorder that needs treatment. So, for example, malaria needs treatment, typhoid needs treatment, depression is a clinical illness. Which needs treatment per se. So it means that you are looking at certain at a resolution, so to speak. Whereas when we speak of neurodiversity or neurodivergent individuals, like for example those who have autism, we do not speak so much about treatment, because what is it exactly that we are trying to cure? We are not trying to cure somebody here. We are therefore what we are doing in fact for autistic individuals is intervening and attempting to intervene as early as possible in terms of how are we going to sort of help them along their developmental trajectory, help to correct the mismatch that often exists between the individual and their environment. How do we do that in terms of facilitating communication? That is often a very critical sort of an area of difficulty for an autistic individual. So intervention is essentially that. It is how to optimize an individual's outcome, how to assist them developmentally, not how to really bring about a complete resolution of whatever are the set of symptoms that they are presenting with. I hope I was able to kind of make that clear.
Yeah, very much so. Actually, autism isn't a disease; it's a condition, right? So
Absolutely.
disease needs treatment, but condition needs intervening, as you said, as per
And
my understanding goes. Yeah, Anupam would like to add something to
yes,
it.
and moreover, when we talk about intervention, it is a planned sequence of events wherein we have a particular set of goals. We are targeting each and every behavioral aspect at a particular set of time. So it's not everything that has been, done together. One, aspect of behavior or one aspect of conditional symptoms has been, targeted and eventually intervened so that the further deterioration of that particular individual in that aspect or parameter does not take place. So we are trying to put a slow gap, not exactly a stoppage, but how best we can help that particular individual in that particular symptoms, and eventually stop the further deterioration. That is what I wanted to say. So basically, when we talk about intervention, we are just breaking down the entire therapy segment into bits and pieces for and eventually having a say comparable statement that we do. Previously ऐसा था, अब ये ऐसा हो गया. The child was like this, and now the person is like this, and this is what is expected if we follow this particular plan of intervention techniques. So,
Yes, very true. There are a few questions for you, Anupam. One is this. You're mute.
sorry. So,
Yeah.
Michael, I would like to bring it out that obviously autism is something that is prevalent, or say that sees every age group of individuals. So it is not that a child of 2 years might have autism and a 34-year-old might not have autism. So at times people do not even realize that they are autistic. So as and when the realization takes place, the intervention is needed. So as what you said, we cater to each and every group of age group of child. It is not that a 50-year-old autistic individual would be left alone. We help them in that as well. We are
Anupam,
located.
here, Mr. Michael Pillai is the Vice President, West Zone of Autism Society of India.
Yes.
And where are you located? That's his question.
Since we are a service provider company, definitely located online, but I am based out of Bangalore, and providing services to anybody and everybody across the country is not an issue from our end. So my main purpose of my organization is to make the service provider meet the the affected, or the special need person, or the parent. So I'm like a bridging gap between them.
Thank you. Thank you very much, Anupam. There are a lot of social stigma attached to autism or neurodiversity for that matter. So often the mental health of autistic persons as well as their family members get impacted. How do you handle them, Sreyoshi?
As you very rightly pointed out, certainly in today's world, especially during COVID and post-COVID, even neurotypical individuals are facing so many challenges with regards to our mental health. I mean, we all are, and for an autistic individual, it's sometimes all the more challenging because they don't have very often interpersonal channels that can really buffer their stress. That is often difficult for them. The way that we can just kind of communicate our distress to somebody, and sort of brainstorm ideas to feel better, that may often be a challenge for individuals who are on the spectrum. I think, which is the reason that many a times mental health concerns are not addressed really for autistic children, is because they're often not identified at all. Now, because communicating emotional distress is difficult, it's often sort of viewed in the form of problem behaviors, right? And I think the most important thing that one has to do is identify that there may actually be a mental health issue that that may have been overlooked. So it's a concept called diagnostic overshadowing. When an individual has, say, new onset behavioral problems, but it's just attributed to the fact that that they are autistic. So, for example, it may happen that, I mean, many parents come to me and say that, oh, my child is like extremely, restless, very agitated. This seems to be a behavioral issue, and I've been told to, get medication. Otherwise, the school isn't going to keep him. Things like that. Now, so what we do in such a situation is we really try to analyze, first of all, is it a recent onset problem, which means it's more likely to be a behavioral issue as opposed to perhaps a restrictive, repetitive behavior or a stereotype, which may be a part of, the autistic condition itself. So if it's a more recent onset problem, right? It has kind of a discrete timeline. It's more likely to be a mental health problem. Then we try to kind of analyze what are the situations or what are the antecedents, what are the environments in which this behavior is happening. So it may be that the agitation is happening, many a times it happens that when they come to the doctor's chamber, right, or in a sort of a closed environment, that's when it's happening. So which means that that's clearly anxiety then. Right? We can see depression also, in which we have to then look at other behavioral indicators. So what is happening with the sleep and appetite? Are they more less playful, less interactive than usual? Right? So I think we have to kind of try and figure out, and this one's hard to do, like whether there could be obsessive compulsive disorders. It's hard to tease out obsessive compulsive behavior from stereotypical behavior. So it requires a careful kind of analysis of what are the behavioral issues, because almost in always the mental health problem is going to be seen as a behavioral a list of behavioral issues that parents and teachers may present. So I think once we have the diagnosis, the treatment is not dissimilar from how one would address the problem in a neurotypical individuals. The set of medications are largely the same, for severe issues.
I have one thing to ask here because for autistic individuals, both receptive and expressive language is a challenge, right? So identification must be like very difficult. What do you think?
It is in fact very difficult. So often that's what, so clues that we get are from a very detailed sort of a functional behavioral analysis, and many times that doesn't happen cross sectionally. So if we suddenly ask the parent, what are the situations in which you're seeing this restlessness or the spike in agitation, if I'm suspecting an anxiety disorder, it may take the parent several days of actually maintaining a chart of their child's problem behaviors, paying close attention to it before they sort of realize that, oh, this could actually be say a phobia of a particular situation, or environment, or maybe it's like a social anxiety or a separation anxiety, something like that. So it's not easy, but there are language is not inevitably a problem with all children on the spectrum. I mean, there is a section who kind of come under Asperger's, earlier diagnosed as Asperger's. They can communicate sometimes. So we have to see what is the best way to sort of facilitate communication of their emotional distress also. So sometimes we may have to use more of play materials, art, drawing, things like that. If they're able to kind of draw a picture of the time, say for example when they feel anxious, maybe that might allow them to express it a little more easier than in verbal ways. You're on mute, Manobina.
Yeah, there are a few questions for you, Sreyoshi. Let me just show you. How important it is to check blood circulation to the brain for neurodivergent child with genetic disorder. Does transcranial Doppler test help in this regard? This is one.
So, a transcranial Doppler test is not one of the tests that we do typically. So ordinarily for a child who is on the spectrum, we don't usually order a battery of investigations. There are some specific situations when we may suspect that, okay, there might be some sort of a neurometabolic disorder or some medical illness underlying the presentation of autistic symptoms. And that is when, for example, there has been a regression of acquired milestones, a sudden loss of milestones which the child was previously demonstrating, or if there are a history of seizures, then you might want to do a more detailed investigation, or if there are particular neurological signs and symptoms. So we do usually Do treatments like cranial brain stimulation help? No. We don't really recommend any brain stimulation treatments. Currently, there a lot of these treatments are under research. For example, TDCS, transcranial direct current stimulation, for a variety of conditions, not just autism, for dyslexia also. But as yet, they have not entered the mainstream really. So,
Uh,
so in response to the previous, we don't do that Doppler test at all. We do something if we suspect an underlying medical illness. TMS is something that we do, which is that's tandem mass spectroscopy. That's done at NIMHANS. That's it kind of rules out a whole bunch of conditions. But again, I want to emphasize that it's a very small minority of children who present with autism who may actually have one of these underlying conditions.
Sreyoshi,
And
I have, sorry to interrupt you. I have had a few parents come to me and ask me in case if stem cell therapy can help with their autistic children. So, I don't know. At times, it's difficult for me to answer them because, as far as I know, answer is totally different. But I would definitely want to hear it from you. In case if stem cell therapy can, actually help severely autistic child or probably a child on spectrum.
so again, these are all areas that are still of more of research interest as opposed to coming into really mainstream clinical interventions. Um, I know that there is research ongoing, for stem cell therapy in for an autistic child, but I think we may have more clear answers, not even in 1 or 2 years' time, but I think it's going to take maybe 15, 20 years before we see some sort of research outcome and the evidence base developed to an extent that we can even think about kind of mainstreaming those things. As of now, um, no. And the thing is, we may be looking at those, so it's such a diverse condition. Really, there are like multiple brain pathways and genes involved. So where are we going to target the stem cells? So I mean, I'm not really convinced with most of these biological therapies, and I view them with some amount of skepticism, because we have to rely on what we know works, which is early intervention, which is kind of intervening when the brain is still largely very plastic, when synapses are still being formed, and seeing how best we can optimize their developmental trajectory at that point.
A few more questions. How the anxiety level of young autistic children in the age group of 8 to 10-year old may be reduced?
Yeah, so I think we need to work on that along two sort of parallel pathways. One is almost inevitably the anxiety is related to a social skill deficit that this child has. So, for example, when they're unable to assert themselves, in a peer group, or when they're unable to make a request, they get anxious because they don't know how to really negotiate that particular situation. And then of course it may lead to the anxiety may manifest in different ways, like hitting or shouting or those things. So on the one hand, building the skill, which the deficit of which is really contributing to the anxiety, and secondly, while we are doing that, to see how we can make these difficult situations easier for children. So some amount of environmental manipulation then. So if we know that, say, um, going to a park full of children is going to trigger anxiety, right? Because we may choose to take them at a time when it's less busy or when there are fewer children. We may look at how to do this in a graded way. So how can we maybe promote peer play in a supervised way, on a one-on-one fashion, before kind of exposing them to a whole group? you know how can we couple that with practices like relaxation? So we kind of um, help them with the situation. We expose them to difficult situations in a graded fashion, while at the same time practicing with them how they can relax while they do it. Right. So you can use different forms of relaxation, whichever helps. And sometimes we may have to take aspects, that are unique to that particular individual. So every, autistic individual is different. So some of them may have particular activities that are especially soothing for them. So, in that case, there may not be a sense in prescribing very typical relaxation strategies. We may have to look at what works for this particular child. So it's a combination of, managing the situation while it's happening, while kind of bolstering their skills so that in the future they find it easier to navigate the situations that are producing the anxiety.
Yeah, Sreyoshi, she has asked about the younger children, intervention for younger children here. But are these mental health
Yeah,
issues, or
so that would apply.
do they decrease with the growing age of autistic individuals? What do you think?
Are you asking if anxiety reduces?
And mentally, all other mental health issues as well.
Um, I wish I could say yes, but unfortunately, that's
That is,
not what we see. I mean, adolescence is a particularly difficult
and
time.
it purely depends upon the situation that the child is in and the environment that the child has been exposed to. So every autistic individual would have a different set of, that's the reason why we say they are on a spectrum, because no autistic individuals are same, and no two autistic individual might have the same symptoms or the same meltdowns or the same kind of anxiety. So one thing might trigger one person, the other thing might trigger the other person. So it purely depends upon in what kind of environment that the child is in, and the people that the child is interacting on a day to day basis, the social circuit that the child is in. In case if the parents are allowing the child to meet other people, other children, because at times in our society we parents do not allow our autistic children to mingle with other children because there's obviously a social taboo that is there, and we also have a fear of our children getting bullied. So and that definitely has a reversal effect on the mental status of the child. So we think that the autistic child cannot understand, but it is not that they understand very well. It is just that whatever they understand they cannot replicate in action, so probably not being able to express themselves.
yeah, exactly. So, and why I wanted to ask this is I was reading the other day, and that life expectancy of autistic individuals or adults are greatly impacted by the number of uh, suicide cases that take place around the world. So that means these depressions, these anxiety issues are kind of lifelong. So, what is your opinion about it, Sreyoshi?
Absolutely. So, like I was saying, I wish one could say that, that things do get better. And although it is very multifactorial, as Anupam was pointing out, the statistics do tell us exactly what you were saying, that it's the mental health suffering of autistic individuals is definitely more than that of neurotypical individuals, to the tune of almost 5 out of 10 autistic individuals experiencing mental health problems like anxiety or depression. Some studies say even higher, like 7 or 8 out of 10, having mental health problems. And certainly, suicidality is also a very pressing concern, for this group of individuals, as well as anybody who is different. For example, it's also high in those who experience gender dysphoria. So, you know and definitely society and the societal stigma does contribute to that, because bullying is experienced by many individuals on the spectrum, and it certainly does contribute. It's considered a form of developmental trauma, and it does contribute to the start and to the perpetuation of mental health problems. And then, as they get older, then different forms of, like feeling alienated and stigmatized, certainly, which is, apparent the research tells us that it's even more for women who are on the autism spectrum, because sort of relationally they are impacted more, by the sort of stigma and the discrimination that they may face.
What role the family can play to deal with it?
Um, I think the family is the most important advocate for the child, and I think advocacy is really something. I mean, all of us should take it up, of course, and we are, but I think families are positioned very critically, in that role to really integrate and to really speak up for the autistic individual in that sense, and say that this is that inclusion is our right. It is not some sort of a privilege that we should be granted. It is and to see really what can be done to mainstream individuals who are on the spectrum as far as possible. And I think we need to work together, families, mental health, professionals, all of us need to kind of work together to move towards a more inclusive society, because that's ultimately what is going to definitely affect and improve the experience of mental health for so many people on the spectrum. In addition, I think if families are sensitized as to what are some of the sort of red flags that there may be a problem, that there may be a mental health issue that needs addressing, if they can be aware of that, they can be more if they make themselves aware of what sort of help is available for what problem, then they could maybe kind of input more holistically about how they can really assist a young person on the spectrum. So families are already doing so much.
And I would say mothers are the first people who come to know that there is something wrong with their child. They are the first people to assess.
Yeah.
And it's what we do is, we first tell the mothers to open up, you know, because they are the people who are under a lot of societal pressure. First of all, the kid isn't performing as per the societal norms. So I'll just give you an example. When I say BIRDS, so what is the first thing that comes in your mind? Just as you would talk about birds that flies, but somehow you tend to forget about penguins. They are also birds. So just that they cannot fly, you have just left them aside, because that is what society has done. They have set certain norms and rules that a particular child needs to fit into that norms and rules of the uh, preferable working. So, and since this autistic individual is not fitting into that, so he has been shunned out and been behaved like an outcast, and that severely impacts the mother. So what we do is we tell the mothers to be stronger, need to come out, to open up, and eventually she is the one who needs to advocate the same thing among her family circle, that the people in her circle, the neighbors, the society people need to be more patient with the child, because the child isn't an alien, is also part of the society. And eventually there are certain, as what we're talking about, certain triggers that the mother needs to understand. This particular trigger might cause a meltdown to my child, so I need to work in this or that particular fashion to avoid that trigger. So eventually addressing the needs of the child and adjusting the child to adapt into the society. uh, Otherwise, since the child is not able to express socially, as I said before, what we do is we keep the child locked up in the house. We don't let the child interact. So it's just that if you don't let the child interact, how will the child learn? So allowing the child to mingle up, to be friends, would make a lot of difference. Initially, yes, there's going to be problems, but eventually everything is going to, it's like a puzzle, it is going to fit in. Everything takes time. So as parents, I have been in that shoes, so I know, I understand, other parents of autistic children, that it happens. There is social taboo. People would come and tell you, but you need to have your foot strong. You need to have a strong hold. Just think about your child and what your actions and how your actions can benefit the child. So, work in that aspect rather than thinking about what the other people is going to talk about my child.
Yeah. There's one more question. I think it's for you, Anupam. You were talking
Yes,
about some therapy. So it is for art therapy. How is it
yes.
helpful?
Uh, to be honest, yes, Michael. To be honest, there are autistic individuals who are not able to express themselves. So art works in helping them express. So whatever they are feeling, they can express it out through art. So it helps in communication. So as I said, it takes time. When you start with art therapy for the child, the child calms down, is able to express, because most of the anxiety or the anger vented out by an autistic child is because he or she has not been understood. So through art, you can actually understand the child and helps the child to communicate. So that's the reason why we say, and colors, play a very soothing role on a mind of a child. So, and I think every child loves to play with colors. And I'm still to come across a child who's not comfortable, mixing colors and putting their, that getting that sensory feeling of dipping their fingers in the colors and painting the wall red, red and blue and purple. So art therapy definitely helps the child, basically in expressing himself or herself. Manobina, you are on mute, I believe.
Oh, thank you very much, Anupam. And one more question. I think it's for Sreyoshi and Anupam both. As parents, how to deal with the social taboos about
Uh,
autistic children in a society we live in that is not so supportive.
Simi, I'll be very honest with you. As a parent of an autistic child, I had shunned each and every negative person out of my life. So that is how I started. So anybody coming and giving me sympathy for my child, it was a no-no for me. I said, I don't want your sympathy. You will not understand what I'm going through. So I have my own set of meltdowns. My child has her own set of meltdowns, and that was my stepping stone of understanding, because I can't expect everybody in the society to understand what my child is going through. I can't expect that. We are still, in phase of understanding that mental health is not. I mean, our country is such that when somebody is dealing with mental health, we say jadoo tona ho raha hai. There's a ghost coming on that person. So that is the status of the society. So that is something that you can't help. Just keep yourself away from negative people in the society. Join positive groups. In fact, join, as a parent, I would, as a parent who has an autistic child, I would suggest you to join a parent group online who has children, on specific parameters of autism or ASD. This will help you understand what they are going through, because they are the people who would be able to help you understand your situation better, rather than looking out for help from people who are not in your shoes. They don't know you, they don't understand you. So as mothers, we need to connect well with other mothers who are going through what we are going through, and how therapies have helped them and how they can help us. Probably there's a lot to learn this in the specific parameters, and we can definitely hold each other's hand and walk together. So I'll tell you, I've not even come across a single mother in a social group that deals with autism who have bullied another parent. Trust me on that. Every parent there are ready to listen to you. They are ready to take your meltdown. They are ready to listen to your children's meltdown, because we all are together walking in the same shoes.
Yeah,
It's like
and
birds of a feather flock together kind of a situation here.
And you were talking about meltdowns. Sreyoshi, I come to you now. Could you suggest some good activities to address a meltdown at home?
I think the most important thing to do when looking at how to address meltdowns is to actually preempt the meltdown. Because once the meltdown is or has already reached its peak, I mean, I don't know whether there is a whole lot that can really be done. You can't de-escalate a child very easily once they've already, they're in the midst of a meltdown. So I think the most important thing to do is again, going back to what I was speaking about earlier, is to do a behavioral analysis of why the meltdowns are occurring. So is it happening when a child is bored, not stimulated enough at that particular point in time, or when they're hungry, or sleepy, or when something is making them anxious, or because there is a certain amount of unpredictability, like they don't know when to expect something. So what can we do to fix that? So, for example, if they don't know when they're going to get a particular treat that they like to eat, right, then they could keep on sort of asking for that, and you don't give it, and it's been given in the past, it could lead to a meltdown. But supposing they predictably get one of that every day after lunch, right, even for someone who is more severely affected, who doesn't have a very good time concept, this is something that makes life more predictable for them. So in a sense, we've understood why it's happening, and we've sort of preempted it. So but once the meltdown is already kind of happening, again, to try and see if we can detect it when it's still at the early stages. So what are the signs that a child is getting anxious or pretty angry? Can we first try to identify those signs as parents, and then help our children also to identify those signs, because that is really where you can intervene, and then do an activity that the child finds soothing. Again, for many children on the spectrum, it may not be the typical activities that we find soothing, like um, um, whatever it is that we find soothing, cooking or something like that. So it may be something different for for many of them. It may be a more proprioceptive activity, like rolling on a ball, or being sort of rocked back and forth. So we kind of need to see how we can use a range of activities to calm them down when it's still at the early stage. Once it's kind of really escalated, I think you kind of just need to be present there and keep some parents feel that they have to sort of withdraw and distance themselves, and I don't feel that's a very kind way to go about it, but just to kind of be present there, not reinforce the meltdown more by doing a lot of hugging and all of that at that point, but just kind of be present, be available, reiterate that to your child, that I'm there, calm down, it's okay, and then just wait it out if you haven't been able to sort of prevent it escalating.
One more comment here. Music also works wonders. That is true. Actually, I always try to um, adopt to this therapy for my students, and it really works wonder. And when a particular meltdown takes place, tearing papers, this activity can also help. So it's an experience. Yeah, there are many experiences, but there's an echo, I guess. I had a lot of questions for both of you, but audience, our viewers have, I think, more. So there are a few more questions in the comment sections. Let me take one by one.
I think it is important for the parents to, help the child understand, you know, what they are going through. If the child is in a position to understand, obviously we have children on a different range of spectrum, so different, levels of autism. So if a child is in that position that he or she can understand, uh, it is important for the parents to make them understand, what he or she is going through, and what his or her action is eventually impacting the parent's life also. That is how I do it with my child. Whenever she has a meltdown, I always tell her that, my daughter's name is Avisha. I said, Avisha, please don't do it. Mama is not liking it. Mama is not liking it. So she eventually, after, when she calms down a little bit, she understands that, what she has been doing is little wrong. Uh, I do not blame her, because the certain triggers of meltdown is something that, it cannot be helped. We as parents need to identify that. Probably it is my fault also, but not in terms of not identifying those triggers, and forecasting it that she is about to have a meltdown, and then taking her away from that particular trigger or that particular portion of segments of society, and eventually calming her down. It is important for, basically, I would say, not very small autistic individuals, but yes, we have teenage, we have adolescent autistic individuals who are in a position to understand that, what they are facing through, and what they are going through, and their symptoms, and what exactly is that cluster of symptoms called. So they can understand, I think, if they are in a position to understand that, that during the analysis of the child, the parents would have come to know that, what is the position of the child in terms of the autism spectrum, whether the person can understand or cannot understand completely. uh, so, till the time they can understand, the parents can definitely take them through that ladder of,
So just to add to that, of course, if we're thinking about communicating a diagnosis, or giving a name to a set of difficulties, then we're already considering someone who's high functioning, right? And many high functioning individuals on the spectrum, they already kind of suspect that they're different, in some ways from other more typical children, and that bothers many of them. They would actually, bring it out. They would talk about how it bothers them that they're not able to really fit in. So, and it's not just autism; it could be ADHD also, in other conditions. So, for many such individuals, it can actually be liberating. If and it's viewed by many as a part of their identity. The fact that they have autism, many are able to embrace it. So it can really be a turning point if you are able to communicate, to your child or adolescent, that they have something that has a name, and it often gives them a sense of belonging also. And which is also why, when the DSM removed, names like Asperger's, many people who had that identity that, I have Asperger's, they didn't like the fact that it was just done away with, and they're now, all of them are under that bracket of ASD. So, while we need to be careful with labels, it can work two ways. So, it can actually have a beneficial impact also, if it's kind of done in a nuanced, careful way.
basically helps the adolescent or the child to understand, the feelings or the emotions that the child is going through, is actually something, and it can be addressed and can be worked on. So you cannot brush everything under the carpet. If a child is undergoing some turmoil in the life, not able to express, obviously there are, the child knows, as what Sreyoshi, you said, that the child knows that there's something wrong with the child. The child is aware, or the adolescent is aware that there's something wrong. It just that when it gets addressed, they are at peace. That yes, something about me has been understood, and I'm not alone. There are other people also, who are similar to me. So that is reassuring for that person. But again,
Yes,
it purely depends upon the way it has been brought up to the child. The
very true.
communication is a major part.
Yeah, yeah. You're mute. You're on mute, Sreyoshi.
Sorry, right. So, and often, many famous people also do identify, as autistic, right? So you suddenly, you see, okay, there is Greta Thunberg, and she's doing such great work, and there is Temple Grandin, and she's led such an amazing life. So there is that, that sense of identity also, and that, they can also get examples of role models. So I think it can definitely be considered, to speak to them about. what it is
Uh,
really that they
and
experience.
I was listening to Anupam. Anupam's, see, a parent of a family or a family generally do a lot of research for helping an autistic individual at home, aren't they? But how can one shift through the plethora of information available online? How will
Uh,
you guide them?
it's a very important question, Manobina. Very important question, because what anything and everything that is available online may not help for your child. So it is very important that you have a basic screening of information that you do. So what I suggest the parents who connect with me is that it is okay to receive information online, screen it yourself, but it is very important to speak to your therapist. So do not take any decision, anything on by all by yourself. There are doctors available, there are therapists available who are professionals in this segment, and they have seen cases like this before. So your child or you are not new to them. So it is very important, and I advocate it that please go and visit the doctor, please go and visit the therapist. Whatever questions that you have in your mind, whatever the online, whatever the suggestions that you are receiving, before you imbibe in your daily life, please speak to your therapist, please speak to your doctors. They are the best people to guide you in this. Definitely, we are there. I am there. Manobina is there. We all are there for you. But whoever, whichever doctor you are taking your child to, or you are thinking of taking your child to, have your questions ready, have your informations ready. I'm pretty much sure they would love to answer that. So what I say is, please screen whatever information you have. Do not start acting on that information, promptly. Sit and analyze whatever you have received, how it is going to benefit your child, because every action has equal and opposite reaction. So you never know that it might work against your child. It may work for one child, it may not work for your child. So it is very important for you to, again, as a stress, meet your therapist, meet your doctor, and eventually whatever you have in your heart, just vent it out to them. They would answer it.
Yeah, thank you very much, Anupam. Shushi, would you like to add something to it?
Yes. I think this is a tricky question because there are so many different forms of therapies that have now been, publicized and advertised, for ASD. I think first and foremost, one needs to be, or I am very skeptical of all of these biological therapies that are floating around. So whether it's chelation therapy or there is hyperbaric oxygen, there are so many, even stem cell, um, right? So anything which is fancy, has a big name, and seems very expensive, I think is something that one should be definitely wary of. Most of those do not have an evidence base at all. What is likely to work is, especially for skill building. Again, I'm not talking about treatment of, say, coexisting conditions like depression, anxiety. There may be a biological sort of a component like medication, but for skill building, for building the core skills, what works are the non-biological interventions, really. So that's something to remember, that is it a behaviorally oriented sort of an intervention. Then of course, then one has to sift through the different kinds of behavioral therapies that n number of institutes are offering. So how to kind of suspect that it may be a good fit? First and foremost, if they have a baseline, if they're going to establish a clear baseline of what the child's current abilities are in different developmental domains. So if they're giving you a clear idea about how is your child doing in terms of receptive language, expressive language, self-help, social skills, cognitive skills, and if they kind of seem to have a plan to work on all of these skills, but while at the same time targeting the core deficits a little bit more, which are essentially the social communication skills. One should be wary if the particular therapist or the school kind of offers to do it all and says parents are not required. Very wary, because the parent is really the person who is going to be the key player to make the skill acquisition generalized across different contexts. Something that is a skill that is acquired in a therapy room, right, is not as useful as how a parent can then take that learning and then generalize it to different contexts like the child's home, the playground, the school. So to what extent is the parent being involved in the sessions by the therapist is definitely something that the parent should consider. To what extent are they being guided about what to do at home? How naturalistic is the intervention? Like, is the therapist saying it can only happen in this room with this many play materials, or are they giving the parent clear guidelines about how to make it naturalistic in everyday settings, right? And also, is how child led is the therapy, like are the child's interests and strengths kind of being kept as a central focus here, or is it entirely sort of therapist driven? I feel the child has to learn A, B, C, D today, and I will do whatever I can to make the child learn it, including use punitive measures if necessary. So that's not the approach that we're looking at. So the parent has to kind of do this kind of
I
analyzing.
don't think, and I don't think that kind of approach would actually work. You know, you are forcing
Absolutely,
you are forcing a crocodile
absolutely.
to climb a tree. That cannot
And
happen.
ultimately, that has created such problems for us as clinicians, because the child will refuse to go to all therapy
True,
after that, because there has been an aversive experience with a particular therapist who was too harsh.
true, true, true.
So because fear conditioning is happening all that much more readily in a child on the spectrum, because the world is that much more threatening for them, right? So
Yes,
one has to be gentle, it has to be child led, the approach has to be parent involved, should be naturalistic to the extent possible, and definitely, yes, should be a bit intensive. So we want at least 20 hours a week, not necessarily at therapy, this is including whatever the parent is doing for the
yes,
child or the school may be doing for the child, right? So if we kind of keep these things in mind, we may be able to pick a therapy or an intervention that is a good fit.
Thank you very much. Thank you very much, Sreyoshi and Anupam, for your inputs. So it's time actually for signing off. But before that, I would take only one questions. There are many. Uh, so one more from Mr. Michael Pillai. Yeah, ASD on Asperger's.
Yeah, so I think, to an extent, maybe there was some confusion with really splitting, the diagnosis into so many different. So there was, Rett syndrome, there was Asperger's. So maybe it created, confusion as to, what these individuals required. So by clubbing it all together, we're really focusing on the core problem, which is the social communication deficit, and we're putting that, we're making that as the highlight. We're not even saying language so much, right? We're saying that social communication is the core issue here, and let's kind of focus on that. So, but that doesn't mean that it was taken very well. I mean, there is a lot of criticism also for kind of lumping it all together. But I guess ease of sort of diagnosis and also starting intervention, as opposed to having many different categories, which may have made it more confusing, I suppose.
Thank you very much, dear friends, for your time and inputs. Let's hope to continue this discussion on a later episode because there are many more questions for our experts, but we really don't have much time today. So before we conclude, Anupam and Sreyoshi, your concluding comments and advice, please. Anupam, please.
Uh, what I would say is, see, every autistic individual is different. And as I had said before, that when we talk about birds, we only think about those who can fly. We rarely think about penguins. We do not think about the bird who can run, the ostrich. So when a child is been diagnosed with ASD, as parents, we should not lose hope, because maybe the child may not fit into the parameters set by the society, but you never know, your child might be genius in some other field. So just focus on that, be strong as parents, focus on that particular field, and just let your child excel in that, instead of forcing your child to develop skills which the child is not ready to take in. So whatever the child is, his strength, basically focus on the child's strength, is in short, I would say. Every therapy, everything should surround around that particular strength of the child.
Thank you very much, Anupam. Sreyoshi,
Thank
please.
you, Manoj.
Yeah, I think I would just like to reiterate that message because it's the most important message, really. And that is to embrace neurodiversity, right? We're embracing diversity now in all walks of life, when it comes to gender, when it comes to sexual orientation, when it comes to skin color. Earlier it was all that, if you're on this end of the spectrum, it's okay. If you're typical in this way, it's okay. If you're not, then and it's really something to be ashamed of. But when we're embracing diversity now in all walks of life, I think neurodiversity is just the next step, really. So while we try to train our youngsters with ASD on improving the eye contact and social skills and all of that, it shouldn't be that we're trying to make them typical in that sense, because that can also be very stressful. It's something called as masking, when high
Yeah.
functioning individuals, they keep trying to mask their symptoms to fit in and to fit in, so they should acquire these skills for themselves, not for us. Why should they acquire it for us? Right? It has to
Right.
be for themselves, to make their lives easier, not to make our acceptance of them more easy. So that's just the message that I would like to send out, that we have to embrace neurodiversity. It's high time that we as a society really stepped up and did that. Thank you so much for having me here.
Thank you very much. Thanks a lot, Sreyoshi and Anupam.
Thank
And
you,
thank
thank you,
you to, and thank you to my dear audience for your involvement in our discussion. And I hope to come back very soon with a milestone episode of Let's Talk Inclusion. Yes, our next episode is our 50th episode. See you then. Till then, take care and goodbye. Thank you very much, Anupam and Sreyoshi, once again. And bye.
Goodbye. Bye. Good night. See
Good
you.
night.